Yep, I hear you. What was that? Can you repeat that? What were your symptoms again? If you have ever heard your doctor talk like this, chances are they were not active listening. Like you, I have been to the doctor plenty of times and I've had plenty of different doctors. I also want to be a doctor when I get older, so I know how doctors should act around patients and what they should be doing. They should be active listening, but why? I will be informing you on the key factors of active listening and why they are important in the medical field. I will be discussing why giving the patient undivided attention, good body language, and acknowledging your patient is important. First, I will be talking about why giving the patient undivided attention is important. Undivided attention is important and is a key factor of active listening. But what is undivided attention? Undivided attention is when a person focuses on only one thing, hence their attention is undivided. Undivided attention will allow the doctor to remember patient's vitals, information, etc. It will allow the doctor to recall more information and will have that information in store when they need to use it. If the doctor doesn't focus on anything other than the patient, then they will be able to recall more information. According to Macy Bygrave's blog, an American study by the University of the Caribbean School of Medicine and Queen's Hospital, UK, found that presence of undivided attention during the handover of a surgical patient in the post-anesthesia care unit has a direct correlation with improved recall of information discussed during handover. If the doctor listens, it will make their job easier and will allow the doctor to remember important information that he or she needs to know. To add, other than the doctor being benefited by undivided attention, the patients will also be benefited. This key factor of active listening will allow the patients to feel like they are being heard. It will allow the patients to feel like they are being validated and what they are saying is important. When a doctor is giving all their attention to a patient, it will allow them to be more open and honest. If they feel like the doctor is not giving all their attention, they will be more likely to be closed off and reserved. Now that we have talked about one key factor, let's talk about another, body language. Body language is another key aspect and is very vital in the medical field. According to Merriam-Webster Dictionary, body language is the gestures, movements, and mannerisms that people and animals communicate with others. It is how we act and how our body is around other people. Showing good body language can make your patients feel as though they are being heard and paid attention to. Craig Conover, an MD from physicianpractice.com, states, patients above all else want some type of validation for how they are feeling, whether they are getting a routine checkup of diabetes or they have a sore throat. Patients want to feel as if you, the doctor, is listening to them and that their symptoms and conditions are real. Showing body language that is accepting and open will allow the patients to feel comfortable and honest. They will allow them to give out the information that they need to if they're receiving good body language. They will be less likely to be closed off. Also, good body language will allow the patients to want to see you again and keep having you as their doctor. According to Craig Conover again, there are lots of other doctors the patients could choose to see, but they are not choosing you, so help them feel comfortable. Having a comfortable patient is a top priority. Showing good body language helps the patients feel validated, it instills trust, and creates a deeper connection with each of your patients. Now that we have talked about two key factors of active listening, let's talk about the third, acknowledgement. Acknowledging your patients and showing them that you're listening is another key aspect of active listening. Acknowledging your patient means you are listening to them and giving feedback to what they are saying. It means the doctor is taking in and giving back information that they think you need. They are giving you back the information that will help you. Acknowledging your patient allows the patients to feel validated and that they are being heard and respected. Also, acknowledging your patient allows you to clarify what you heard and ask questions if needed in order to write down correct information. On healthfaq.com, it states that, as an active listener, the most important goal is to understand what the patient is saying, meaning you have to acknowledge them to know what they are saying. You have to know what information they are giving you and what their symptoms are to give them back information that they need. Acknowledging makes the patients think that the doctor is actually listening, they are being seen, and that they are important. It will make the patients feel more comfortable. All in all, doctors have to take active listening very seriously, and it is an important part of their career. Now that I've gone over key factors of active listening and why it is important in the medical field, you now know that giving the patient undivided attention, good body language, and acknowledging your patient is important. I hope that you could take this information and put it to good use. Even if you aren't going in the medical field, I hope you can still be a good, active listener.